Hi, I am Poosha, sexologist and sex counselor and consultant at Lybrate.com. We'll talk about a very frequently asked question about sexual function, that is premature ejaculation. Not too many people are familiar with this word. Rather, they would describe their problem as rapid ejaculation. मेरे पति को ताकत नहीं है, स्टैमिना नहीं है. Such kind of descriptions we come across, and the real problem is the male concerned is not able to withstand intercourse for more than 1.5 to 2 minutes, or even sometimes he ejaculates within 1 minute. It is calculated from the time of intromission, that is inserting the penis inside, to ejaculating. The time is either less than 1 minute or slightly around 1 minute. And premature ejaculation is a very, very common male dysfunction, probably the most common male sexual dysfunction, without any bodily cause. So ultimately what we see is, if the male is ejaculating much earlier than the women and than he wishes to, then we consider this as a case to be a premature ejaculation. So a lot of people think this premature ejaculation as a disorder or a disease, which it is not. And secondly, many people attribute this to their past habits, and they call them bad habits, typically put it in quotes. So when they describe their problem, doctor, I have masturbated during my childhood or young adulthood, and now I have this curse of premature ejaculation. I am unable to satisfy my wife, she is very unhappy with me, I am afraid she might even leave me, and all that. So they think that this is the cause, that they have masturbated in the past, that's why this problem is occurring, which again is not correct. Actually, masturbation does not cause premature ejaculation. On the contrary, you can use masturbation as a tool to overcome premature ejaculation. You can train yourself using that one. Whether they are anxious people, whether they have any psychological disorders earlier, what is their family background, what is the relationship between the male and the female, the wife and the husband in our case. So how do they interact with each other, how do they take the problem, are they hostile, are they anxious, are they stressed out, is the marriage in distress, are they quarreling, so are they in good communication, they love and care for each other despite this problem. All these things we have to assess first. So based on this assessment, we choose the method of treatment. We have two methods. One is the natural methods, whereby we will train the couple to first understand how the premature ejaculation is taking place, and then how to control it. Similarly, in ejaculatory control also, initially it appears very difficult and it looks impossible, but then as weeks pass by, you learn every technique piece by piece, and with experience they will be able to overcome the premature ejaculation, and they will be able to enjoy sex for several minutes. I know people who have been able to enjoy sex beyond 10 minutes, even 20 minutes, but let me not quote higher minutes because they are rarer instances. So this is based on natural methods, but natural methods require a good cooperation and understanding between the couple. That's very, very important. But when the couple is in distress, or if the natural methods they are not able to learn and implement easily, then we choose pharmacological treatment, that is drug treatment. There are a number of drugs which can be applied physically outside the skin, or there are drugs that can be taken through mouth. They solve the problem in a way, but they are short-lived. As long as they are used, then only they work, and then after stopping the medicines, again the problem returns. But what we do is, while they are enjoying their sexual life with increased intravaginal latency period, we teach them the techniques, natural techniques, so that the techniques will remain for a very long time and they enjoy their lives. So anyone who is having a premature ejaculation problem should not be distressed. They should understand that this is a very natural phenomenon, very normally occurring phenomenon, and this can be easily resolved through either medicines or natural methods, or a combination of both. So the best thing they should do is to help themselves is to consult a sex therapist as soon as they can, so that the marriage does not fall into distress.